Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former health commissioner here in Baltimore. Our goal is to bring evidence and experience to illuminate critical public health issues. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith-Rogers, producer of Public Health on Call. Today, Stephanie Desmond talks to Peggy Carr, Commissioner of the National Center for Education Statistics, about recent research showing just how far students have fallen behind during the pandemic and what can be done to catch up. She will be releasing new data on the 4th and 8th grade progress in October. Let's listen.
Peggy Carr, thanks so much for joining me.
Thank you for having me.
So your organization released a startling report on how 9-year-old students have fared academically during the pandemic. What did you find?
Well, first of all, Stephanie, let me say that this was very sobering. These results were historic. This is what we call the long-term trend assessment out of the National Assessment of Educational Progress. It's been doing this for a while, since the 70s. And we were in the field collecting these data back in 2020 before COVID was declared a pandemic. And as we were coming out of the field, well, it hit. And the schools started to close. So we have this really great data point of 9-year-olds reading and math that we were picking up right there as COVID was beginning to be a big problem for the world. We went back just this year to collect data from the same schools, 92% of the same schools, and to look at their 9-year-olds to see how they were performing with the same assessment, reading, and math. And so these data that we are looking at really represents the impact on students' performance in this really nice 2-year window inside of the COVID pandemic. Well, as I indicated, the results were sobering. Math scores are down by 7 points. That is historic. The first time we've seen a decline since the 70s for 9-year-olds. And it is a 7-point decline is in fact very significant. We saw a 5-point decline for 9-year-olds, again, historic, the first time we've had a decline of this magnitude ever. We did have a decline back in the 80s, but not quite this big. Again, a historic pattern for these 9. We have no increases. That's the bottom line. And it's more pervasive for math than it is for reading. Although even for reading, we've only seen, if there's not down, a stagnation.
This really feels like a wake-up call.
It is. And I should add that the wake-up call includes disturbing gaps that have widened during the pandemic. You know, we were looking very closely at our lower performing students in this country across a number of data collections that we have been administering for the past couple of cycles. And we have been worried about students at the lowest level, our students in the 10th percentile and 25th percentile, because they were losing ground even before the pandemic. But now it's clearly exacerbated by what has happened. Students, Black and white students, for example, are further apart than they ever were before. White students went down 5 points. Black students went down 13 points. And now, not only are we having to worry about our most struggling students, but the students who were our higher performers that were showing improvements since before the pandemic are now also showing declines. So we have this widening of the gaps for Black and white students and a widening of the gaps for the ability group students. Very significant.
What would you attribute to this? Is this the pandemic, I guess, laid bare for us?
I don't make this statement lightly because we don't often try to attribute declines or increases or any changes in these data to a particular event. But it is very, very clear with the stronger methodology we had, going back to the same schools, 92% of the same schools, and data that I've been collecting in other venues, that it was clearly related to this disruption that we've had in a number of areas due to the pandemic. It is indeed a moment in time when we need to focus on the education system sharply. It has been dramatically impacted. It is a wake-up call.
Sort of where do we go with now that we have this data? We have this empirical evidence that the closing schools was very detrimental to the learning of young people. What do we do now? It's 2 years later, and how do we make up that ground?
Well, let me just say regarding the closure of the schools, because we were tracking that too while we were in the heat of it all. We really didn't have a lot of choice in the matter. People were dying, we all know. And the health officials were telling us that we needed to do that. It was really up to the states and districts who made that decision. I don't think there was a lot of choice. But the educators, the teachers, the practitioners turned on a dime and really did the best they could with what they had. Got resources to students, got themselves up to speed the best they could do. Now, moving forward, we need to do more of that. I would say that there are at least 3 areas I would want people to focus on. One is that students need absolutely more learning time, more time on task. Schooling matters, especially for math. We believe, and this is well documented in the literature, that math is more sensitive to schooling as opposed to reading. Reading is too, but not quite as sharply as math. But we need more time on task, whether it's differential time during the school day, extended time, after school, Saturdays, weekends, whatever it is that we can get. This is the most important thing that we can do as a nation. Even if the time on task can be done in such a way that we can individualize that time on task, if we could do that, we would really, really make a difference for students. It has different names. Some people are calling it double dose tutoring or high dose tutoring, individualized tutoring, intelligent tutoring, whatever it is that you could do to give students that extra help is definitely what we need. And then there's the whole child, Stephanie. Social emotional learning is something that we've been tossing around as an education community for years now. Never more important than it is today to implement those factors that will improve the social emotional learning of students. And everyone can participate in that. Parents, guardians, they can all pitch in to help these students have a better context on the social emotional learning side. We have learned from other data that we've collected that requests for mental health services has been on the rise since the pandemic, and not just for students. The teachers are complaining too. And students are having a tough time with behavior in school. Bullying, cyberbullying is up. I could just go on and on. Teachers are, the absenteeism is going up for them as well as their students. We have a lot of work to do on the social emotional side of the equation. And then the last thing I would offer is if we have resources, and I know that there are a lot of resources that the federal government put out there, if you have resources, put them where they matter the most. Even though we've done a great job as a community helping those students that are really in need in terms of devices and access to teachers, there are still some inequities going on, even in the data that we're picking up. With reading and math are going to have to double time, and we're going to have to help them double time in order to be sufficient. And we're going to need the resources to help us get there.
I'm not seeing efforts to extend the school day, to give extra tutoring, to help make up the difference. Am I missing this? Is it happening?
It is. It is happening. And it's a good question, actually. We have been taking a pulse look at what's happening in schools K through 12 during the pandemic. Every month, we go into a sample of schools and we ask what they're doing. And we've been asking about recovery efforts. Even during the summer, we're seeing that schools are, in fact, embarking upon remediation activities, the tutoring that I described. Yes, it is happening. Now, I'm not here to say it's happening as much as we need it or where we need it, but it is happening.
So I can't help but think what this is going to mean to this generation of kids down the line. Are you concerned about sort of, what this generation is going to, how far they're going to be behind when they get out of school?
Yeah, I share everyone's concern. In fact, some people are calling it the lost generation. I don't know. That's a bit morbid. I don't know if I would say that. We got time to catch up if we get on, put our mouth where our money is, or put our money where our mouths are, for sure. And, I am worried about student preparedness, because it's not just the K-12. It's also the post-secondary that suffered during this time. We had 1 million students that did show up for 2-year colleges, community colleges during this time period. What happened to them? Where did they go? This is the pathway for 4-year learning pursuits, college learning pursuits. It's also the pathway for college and career community college. So we do have a way up the ladder, not just with the K-12. It's the post-secondary too. So let me first point that out. I think that we need to take this seriously. This is a moment in time when we really need to focus on the entire educational system, because it's been impacted in dramatic ways to its core like none before, nothing that we've seen before.
Seems like we need a moonshot for education.
We do need a moonshot, but the thing I like about the moonshot concept is that even if you miss, you've done better concept. We need to do the best we can with this generation of students, so that they're not in the position that we just described. They're not prepared for the world. They can't go to college, or they can't go pursue the careers that they had anticipated, because they're lost opportunities, or they just simply can't wherewithal because they don't have the knowledge and skills. I agree.
And I guess my last question is about burnout. I know you've looked at burnout, teacher burnout. It seems as though, if you could please tell me sort of what the situation is, and then also how that could contribute to having trouble catching up.
Well, we need to worry about a lot of things. You're right. We need to triangulate towards a solution, and leaving the teachers out would be a big mistake. From the data that we're seeing, they are having problems with their own mental health, as I mentioned before. The schools are doing things like providing them incentives, helping out with substitutes when they can find them, to give them a little bit of a break. There is a problem. There's a part of this equation that must include the teachers if we're going to triangulate this problem and fix it. And then, some of these issues with teachers, they're not new. They're not the most well-paid profession in our society. And we know, and I have some international experience, we know that in those countries where, this profession is treated differently and seen differently and paid for their contributions, they get better outcomes. So we have a lot of things to fix. And some of what has happened here is that it's just brought much of it to light.
Well, Peggy Carr, thank you so much for joining me.
Thank you, Stephanie, for having me. I enjoyed my time.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinell, Spencer Greer, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Holes Fernandez and Amber Bryan Singletary. Thank you for listening.